After the momentous day of bringing your baby into the world, moms enter into what's known as the fourth trimester. Those first 3 months with their tiny human, from figuring out breastfeeding to working out through postpartum emotions, the new and unknown can be tough. Hi everyone, I'm Johanna Gomez, your host for today's discussion, coming to you from the beautiful Baptist Health Newsroom. Today we'll talk about exploring everything that comes in those first few months with a newborn and how to make it as smooth as possible. We're joined by Betty Drago, a lactation nurse at West Kendall Baptist Hospital, and also joining us is Ashley Watts, a pelvic floor therapist at Christie E. Lynn Women's Institute. Ladies, it is great to have you both here and to actually kick off these great conversations that we are going to have. But before we dive into today's subject, I want to remind our viewers to send in your questions and your comments in the comments throughout the discussion. We're here for you. We are happy to answer any questions you may have. All right, ladies, are you ready?
Yeah.
Breastfeeding. It is a big topic. It is extremely stressful. As a mom of 3, I can tell you, I had so many questions going into it, and I was blinded by everything that was just getting thrown my way with a brand new baby. But there are a lot of benefits when it comes to breastfeeding. So I'm going to go ahead and start with you, Betty. As a lactation nurse, what are some of the benefits that we should be reminded of? Because it is difficult.
Yes, thank you for having me, Joanna. There's a lot of benefits for mom and baby. For baby, mainly, there's a lot of protection for respiratory diseases, gastrointestinal infections. It prevents type 1 and type 2 diabetes, asthma, all of the allergic diseases that babies can have in the people have in the early
in the
childhood diseases. And for moms also, breast cancer, ovarian cancer, all the cancers that have to do with hormonal.
I was just going to say, there's also a lot of emotional and hormonal stuff going on with your body because you have a brand new baby, and not everyone is built the same and not everyone has the same life. So what tips do you have for new moms that are probably watching right now or about to be new moms?
So mainly you should start from before you have the baby. Education, it's key. So I know a lot of moms, they start saying, oh, I don't have the baby yet. How can I learn about breastfeeding if I don't have the baby to put on the breast? No, as soon as you can, as soon as you make your decision to breastfeed or bottle feed, start researching. We literally have the world in our hands. So actually Baptist has lots of prenatal classes, breastfeeding classes that are free of cost. So it's very important.
I also find that a lot of people are just scared to ask because they might think it's a dumb question. And I think that that's part of it as well. Have you seen that with new moms, that they're kind of like very timid about it?
They are. And also we have to make breastfeeding normal. It's normal. That's what breasts were made for. And there's no dumb question. There's no dumb question.
Absolutely. Ashley, I'm going to go on to you because I told you this off camera and I was serious. I never heard of pelvic floor exercises when I was a new mom. And now I think a lot of people are hearing more about it. Can you explain to all the viewers exactly what it is and the benefits?
Sure, yeah. So pelvic floor physical therapy involves any sort of bowel, bladder, sexual dysfunction, pelvic pain that's musculoskeletal in nature. So with pregnancy, we get a lot of postural changes, we get the hormonal shifts that you discussed before, and that causes a lot of abdominal and core weakness. So it's beneficial to come to physical therapy. We can do an evaluation, check out your posture, muscle weakness, muscle strength, pelvic alignment, and we can get you back to moving safely when you're taking care of your babies and with exercise as well.
Is this just for new moms?
So it's for everyone. You know, we see, like Betty said, we see a lot of pregnant women too, and we see children and women of all ages. So I actually see a lot of women during the menopausal period as well who have had problems during the pregnancy and postpartum period, and they never had those issues that were addressed then.
What are some of the signs that we should be looking out for?
Yeah, so any sort of incontinence, so which is urinary leakage, urinary urgency, frequency, constipation, pain with movement, separation of your belly muscles.
Yeah, and there's probably, if you're a new mom, you probably feel locked because you're also breastfeeding at the same time. There's so many limitations as to what you can do. So Betty, can you remind everyone of the list of things if you are breastfeeding that you should kind of stay away from?
Basically, when you're breastfeeding, that's your only job. So that's what you have to do 24/7.
That is hard. Oh yes, I remember that. But it is true. If you're going to commit, right? You kind of need to commit to.
And it's very important for you to rest, sleep, not just rest and be on your phone or make some phone calls. No, you have to sleep. So that's when your family support is very important. So just leave everything for the family to do, the laundry, the cooking, the cleaning, and you just focus on your baby and your rest.
Okay, what if you are a working mom? It is a reality. Not everyone can just dedicate all their time to breastfeeding. Pumping, we obviously know, is a great option for those that still want to give their child their mother's milk. So what happens at that point? Any tips for them?
You need to pump when the baby is not with you. Other than that, whenever you have the baby with you, you just breastfeed. Because the pumping, it's really good, but it's not the same as the baby.
Right.
The pump will withdraw about 80% of the breast milk, but the baby, it's gonna empty your breast completely, and that's what's gonna keep your milk supply up to date.
Yeah, the fourth trimester is real, going back to what I originally said, because there are a lot of changes, not only in your breast, with your body, Ashley. There's so many ways that moms can try to recover. What are some of your tips that you want to share with us today?
Right, yeah. So a good thing to do is, because of all of those postural changes that occur during pregnancy, and then that's coupled with the trauma of delivery, whether it's vaginal or a C-section, you want to come see a pelvic floor physical therapist to get an evaluation. Some patients we just see for a consultation, but we can focus on strengthening for weak muscles, stretching for painful muscles. We do a lot of manual or hands-on techniques for sore muscles or tight muscles. We do scar tissue mobilization for C-section scars or any sort of perineal or vaginal tearing. And that can impede someone's ability to have intercourse.
And by the way, it could also impede you from nursing correctly, if I'm not mistaken, correct?
Yeah, absolutely.
Because all these changes, if you're overstressed, it's very hard.
Right. Yeah, there's a lot of play between, challenges with the mental aspect of breastfeeding and then having physical changes as well, and the emotional impact it has on moms.
Yeah, it is definitely an emotional roller coaster. And speaking about emotional roller coaster, the postpartum depression or baby blues that you might feel, how normal is it? Can we normalize that if we want to start normalizing things?
Yes, so there's a big change of hormones that's happening when you have a baby, when you're pregnant, and then now you have a baby. So the hormones took 9 months to get to a certain point, and now boom, you have a baby, and they drop really quick. So that's when you have baby blues, and that's pretty normal for everybody to have. Most of us will have baby blues, but they last about a week or 10 days, and that's when you start looking at your baby and you cry for any reason, and that's normal. But after that week or two, if you're still feeling sad, if you're still crying for no reason, if you have insomnia, even though the babies won't let you sleep a lot, but the times that you can, you're not sleeping and you're not resting, then you have to talk to your doctor and find out what's going on.
Yeah, I remember being in the shower and just crying out of nowhere with my first, and I was like, what is going on? I can't control the tears, and you're torn.
Yes.
You want to be happy because this is the happiest moment of your life, and then your emotions are out of whack. So those are some of the signs that you told us about. But if you have to get on medication for postpartum, does that impede you to breastfeed? How does that work?
There's been a lot of advances on medications, so not all medications you have to stop breastfeeding. The best person to ask will be your doctor or a lactation consultant, because there's they can tell you, okay, the doctor ordered you this, but this might be a better choice, so you can continue to breastfeed. Also, when you breastfeed, your body releases oxytocin and relaxin, which are two good hormones that keep you. Oxytocin is the happy hormone, so it keeps you kind of happy. And relaxing, it makes you relax. So that's why it tells you
Actually,
it's good to breastfeed.
More benefits.
I'm gonna shout you out. You are a new mom.
Yes.
And you are like, I feel all these
I
things.
know.
And you understand
Yes.
because
It's nice to actually go through it, because then I can actually have a lot of more compassion and empathy for my patients, and also being able to relate to them a lot
because
more.
you are a new mom.
Yeah.
So you have all these resources for the new moms and moms that have been doing this for a while that might feel some things. What would you say is the best way to help them through this emotional roller coaster?
Yeah, I think a lot of it starts during that pregnancy period, and just building your community around you. And at Boca Regional, a few years ago, we started a program for prenatal and postpartum women, because we really felt it was an underserved area. And it's a multidisciplinary program. It's our Guten program, and we obviously have pelvic floor physical therapy, and then we had a long-standing breastfeeding support group, but we really added to that. We've partnered with Baptist, and they have community lectures. We have a nurse navigator that can reach out to you during those later stages of pregnancy and offer the support that you need. We have Mommy Matters support group that women can jump onto. It's a Zoom. We're starting nutrition classes. So really trying to tackle it from multiple avenues, because women need that, and they really need the support.
Yeah, I agree with you. We absolutely do. And the questions just keep rolling in for today. So we're going to go ahead and get to some of the questions that our viewers have. And we're going to remind you again to continue to send us those questions as much as you possibly can. So I'm going to go ahead and start off with you, Betty, with one of the viewers that they have given us these questions. And it's a great one, because I know this changes with every single person. What should a person expect their menstrual cycle after childbirth? Because if you're nursing, isn't there a bit of a change in your body with that as well?
Yes. So after you have the baby, you still have some bleeding, but that's not your menstrual cycle.
Oh.
That's it's called lochia. It's part of the delivery process. And then if you're exclusively breastfeeding, your menstrual cycle will probably come in at the 6th or 7th month after you had the baby. That means exclusively breastfeeding, your baby's not getting anything else but breast milk.
Okay.
And it doesn't mean that you can't get pregnant if you're not getting your cycle. So
yeah,
sometimes that happens.
It happens a lot. Number 3 for me. You learn the hard way sometimes, and that's the reality. But you just said something. Does the baby still get all the nutrients and the most nutrients even after 6-7 months of nursing?
Yes.
Is it still beneficial?
So usually babies will start with solids at 5-6 months of age. But breastfeeding, breast milk will still be the main nutrition. So the solids is just for them to learn how to eat.
Okay.
But breast milk will be the main source of nutrition. So yes.
So keep pushing through.
It changes, but it's their main nutrition.
Keep pushing through. Okay, here's our next question from one of our viewers. What dietary considerations are important for postpartum recovery?
So for postpartum recovery, you can eat as the same that you were eating as you were pregnant. So when you're pregnant, you try to eat healthier, you try to eat more fruits and vegetables. So just keep the same diet. The only thing that's being researched that might affect breast milk is milk.
Oh,
so dairy. Mm-hmm.
So a mom consuming dairy would affect the child, but isn't that something that some people need?
It's a mom consuming too much dairy.
Got it.
Okay, so if you have your coffee and milk in the morning, and then you have a cheese sandwich for a snack, and then a salad with lots of cheese, then it's dairy in every single meal, then that's too much.
A lot of times people say that they see their child react differently, maybe sleep a little bit more if they eat something, or not sleep as much because of something they eat. Is that false or true?
I think it's a myth.
It is a myth. Okay.
Yeah.
And why would you say, since obviously you are the expert at this?
So actually, the moms will introduce babies' flavors and food through the breast milk.
Okay.
So the only thing I can think about is maybe coffee, because it's a stimulant for us, and then we'll transfer it through the breast milk to the baby.
So something to think about.
But so a rule of thumb is, if something that you eat, it doesn't make you feel good, then it might not make the baby feel good. So
Okay, so this question is for both of you as a new mom. For you, Ashley, what are some of the common misconceptions that you would say you have heard about postpartum period?
I think the biggest misconception is that we can do it all on our own as a mom. We really need the support from our families, our friends, and I know as a new mom, I think I felt the best when I could get some sleep, and by having, friends and family pitch in and help, and being, willing to accept that help is, I think, the biggest benefit.
Yeah, that's a great one, because I think that misconception is there. What would you say it is, Betty?
Same. I agree with you. Sleep, it's number one. You have to rest, sleep to re-energize. A good diet with lots of fruits and vegetables, and let yourself be pampered by your family.
Oh, that's hard. When you're the person that does everything and is in control of everyone's life. What do you do if you have multiples, though? That sleep thing is very difficult when you have a brand new baby and a 2 or 3 year olds running around.
Yeah. You need to be willing to take the help from your family, your husband, your family. Everybody that's around you, they want to help. We just have to give them the opportunity.
Yeah, this is when we learn to let it go and let others help us. Ashley, there's probably some misconceptions also that come with pelvic floor. A lot of people haven't really spoken about it as much. I would say it's fairly new. I think it's like we spoke about earlier, it's picking up some speed. What would you say is the biggest misconception and something that you want people to take away from today's conversation?
Right, for sure. I think the biggest misconception is that people think that stuff is normal, and feeling pelvic pressure or going to the bathroom in your pants is normal. And it's common, but that doesn't mean it can't be addressed, and that you can't receive help for it. So we want to get you functioning and feeling well, and you're not feeling well if your body isn't working optimally. So.
Yeah, but a lot of people are probably embarrassed.
Yes.
So how do you even start off this conversation?
Yeah.
When you say, I just jumped and...
Yeah. Well, you'd be surprised, like just bringing up the conversation with people and they're like, yeah, I have that. That's me. And I think social media, thank you, has really normalized a lot of this, and people realize that a lot more women are affected and can receive help.
Yeah, absolutely. I think that that's one of the positives of social media, of trying to continue these conversations, and also to have conversations like these that we continue to go on. And great questions that our viewers had for us today. It's been really a great conversation with you guys. If you have to say that there's one thing that you want to leave the viewers with, what would you say it is?
I would say take care of yourself. Let yourself be pampered, like I said before, and just be patient and practice.
Yeah.
That's what's gonna get you through it.
Yeah, Betty, I think those are great things. And I think you touched on something else earlier, is start when you're pregnant. And if you have already had a child, for a second child, really try to prepare for, the challenges that you may have with breastfeeding, or, with physical therapy. We love to see people before they're having their baby.
Yeah.
So.
I'm a veteran mom, and I learned from today's conversation. So ladies, thank you so much for your insight. It really was very productive and helpful today. Remember, to all the viewers, be sure to hit that subscribe button on our channel here to keep up with the latest health and wellness information and tips from our experts. You can also connect with us on our social media channels. We have Facebook, Instagram, Twitter, TikTok, and of course, LinkedIn. And check out the resource blog for the latest news at baptisthealth.net/news. You'll find a link there to all the episodes of the Baptist Health Talk podcast as well. On behalf of everyone at Baptist Health, stay safe, stay healthy, and thank you so much for watching.